You're watching KLTX, Channel 15, serving the city of Lufkin.
Good evening, and welcome to the Lufkin Angelina County Chamber of Commerce 11th Annual Salute to Healthcare Banquet, presented by CHI St. Luke's Health Memorial. It's my pleasure to serve again as Master of Ceremonies for this event. I'm Dr. Sid Roberts, radiation oncologist at the Temple Cancer Center. Tonight is a night of celebration as we honor our healthcare sector, including not just the medical profession, but all those who serve patients in various capacities. Lufkin has firmly established itself as the regional hub for healthcare with capabilities far more advanced than most communities our size. We are also a medical community of innovation. Since our last salute to healthcare, a number of local advancements have taken place. For example, Woodland Heights was the first facility in Lufkin to use a first-of-its-kind HD grid mapping catheter that supports the diagnosis of patients with cardiac arrhythmias. And Woodland Heights adopted the Pulsara communication platform that connects Woodland Heights and our local EMS in real time, minimizing miscommunication and delays in emergency care. Dr. Mangla and Dr. Subramanian Venkanta were among the first in the nation to try a new form of catheter that can reach from the wrist to the leg and to help clear blocked arteries. The Heart Institute physicians in CHI implanted the first Watchman device in February, which offers patients with non-valvular atrial fibrillation an alternative to long-term warfarin medication and reduces the risk of stroke. And last December, CHI St. Luke's Health Memorial was the first hospital in the region to offer the Micra transcatheter pacing system, known as the world's smallest pacemaker. And my own Temple Cancer Center at CHI is now offering curative, non-surgical, stereotactic body radiation therapy for early lung cancers. Yet in a time of medical advances, we are also dealing with an opioid crisis that is redefining how we as healthcare practitioners, hospitals, pharmacies, and other agencies deal with pain. It is both a trying time and an exciting time to be in the healthcare field. Later on this evening, we're going to look further into another area of both crisis and opportunity in healthcare, and that is the health of our children. Angelina County is not healthy. That unfortunate fact is supported by data used to rank counties nationwide and compiled by the Robert Wood Johnson Foundation. In Texas, Angelina County is in the lowest 20 percentile for the state of health outcomes. And sadly, for health behaviors, we rank dead last, 242 out of 242. 18% of adults smoke, compared with 14% for the state at large, and many states have smoking rates much less than that. 1/3 of Angelina County residents are physically inactive, and fully 40% of Angelina Countyans are obese. On average in Texas, 28% are obese, with some counties as low as 21%, nearly half of where we are in Angelina County. Life expectancy in Angelina County is almost 2 years, 9 months shorter than for the United States as a whole. We will hear tonight from our speaker more about how to promote health among our youth, a topic which we all need to pay attention to. But first, it takes a true team to put together an event like this, and I want to recognize the committee that worked so diligently coordinating tonight's celebration. So while the committee members and the chamber staff, if you would please stand, I'd like to give you guys a round of applause. We need to recognize and thank our sponsors who make this evening possible, and you can see them on the board over there. Presenting sponsor, CHI St. Luke's Health Memorial. Silver sponsors, Choice Home Care, Lufkin Economic Development Corporation, Pinnacle Senior Living, and Woodland Heights Medical Center. Reception sponsor, Angelina Radiation Oncology Associates. Speaker sponsor, CHI St. Luke's Health Memorial. Sponsor in kind, Boston Scientific. And partners in trade, Liza's Garden and the Wayward Rose Nursery and Gifts. I especially want to have you give a round of applause to those last two folks at Liza's Garden and the Wayward Rose for the incredible decorations that they have provided for tonight. And finally, a thank you to Kate Rudisil and 1921 Catering for what's going to be a lovely dinner tonight. So let's give Kate and her staff a round of applause too. Josh Gentry with the City of Lufkin is producing tonight's video that he did the videos that you'll see later this evening, and I believe they're also videoing the event tonight that they will show on the local television station at a later time. And of course, all the setup help that we get from Brant Lee and the Convention Center staff, we appreciate you guys. So I know oftentimes we have some local officials with us in the audience. I don't know if we do tonight, but thank you for coming if you're here. And finally, before we get our meals served, I'd like to welcome Jeremy Yancey, pastor of Timber Creek Church, who is going to come to the stage and offer our invocation. Thank you.
Good evening, everybody. I had just come out of surgery, and I was barely beginning to wake up. I had experienced several surgeries before. I had had general anesthesia a few different times. How else do you get to look this good? Just kidding, it was a hernia, that's all it was. But I'll never forget how I felt this particular time as I began to wake up. I felt the hands of someone softly and kindly, I want to say caress, but that doesn't sound right, pat my head with a cold rag or sponge or something. They were speaking softly, encouraging me. I struggled, but I just simply could not open my eyes. I did not see them, but I will never forget the tender touch of the woman's hands as she cared for me. At least I really hope it was a woman. All I could do in that moment was blindly say, "Thank you. You're so kind. Thank you for taking care of me. Thank you." I don't know what the hands of Jesus feel like. The Bible describes what they look like, but if I were to attempt a description of the hands of Jesus, I can't help but think of those hands that cared for me when I needed it most. Jesus tells us in Matthew 25, when someone's sick and you care for them, it's like you're caring for him personally. And when we use our gifts and talents to help others, it's like they get to feel the hands of Jesus through us too. What a huge responsibility. What an awesome privilege. Let's pray. Dear Heavenly Father, thank you for the men and women who walk with people they don't know through the major intersections of their life. The intersection of expectant parents welcoming a newborn, the intersection of a family hanging on every word as they hear the tough news about a report that didn't come back the way they'd hoped. Thank you that you put people in our lives that walk with us through these things. And thank you, Lord, that you're a personal God who doesn't watch us from a distance, leaning over the wall of heaven, letting us figure it out on our own, but you walk with us through the good and through the bad. Bless our time together this evening. May we be encouraged tonight, challenged to do more. We ask all these things in the name of Jesus, the strong Son of God. Amen.
Our speaker tonight, Jeremy Lyon, PhD, retired in 2017 as superintendent of Frisco ISD after a 31-year career in education. After his retirement, he worked with the youth division of the Cooper Institute in Dallas and formed recently a consulting business to help school leaders implement strategies to improve health and wellness outcomes for students and school staff. During his tenure in Frisco, he spearheaded a district strategic plan that embraced the whole child concept of balancing academics with physical, social, and emotional supports for students. He also led Frisco ISD in creating unique public-private partnerships with Baylor Scott and White Hospital and the Dallas Cowboys. The partnerships are centered on creating extraordinary opportunities for all students to learn and participate in safe and healthy activities. Dr. Lyon received his Bachelor of Science degree from Texas A&M University in 1984 and completed his doctoral degree in school administration from the University of Texas at Austin. He is passionate about improving student and staff fitness and health within schools and school districts. Here to talk about creating strong kids and healthy communities, please help me welcome Dr. Jeremy Lyon.
All right, well, good evening to all of you, and thank you very much for the opportunity to speak to you this evening. It is a tremendous honor to be here. My wife and I spent 30 plus years in public education. My wife, Dr. Ellen Lyon, born and raised in Gladewater, Texas. Her entire family is from East Texas. And our marriage got off to a really rocky start because my first teaching job was in Gilmer, Texas, and I am a Gilmer Buckeye. And if you know anything about the rivalry between the Gladewater Bears and the Gilmer Buckeye, it's kind of surprising that the marriage survived. But it did, and we are thriving, but we are so honored to be here. Ellen reminded me that both Ellen and I, in 1985, came to Lufkin to take our exit tests to become teachers. And that was one of the bars that got us to the point where we were eligible to teach in the state. And so we love East Texas, we love this area, and we have spent considerable time rooting and cheerleading for East Texas in all aspects. And now, even though I am formerly from Frisco ISD, we get to root for the Lufkin Panthers in the football playoffs coming up. And we wish them the best. It sounds like that's one heck of a football team. So I did go to Texas A&M. I'm a 1984 graduate. When I tried out some Aggie jokes with my wife, I got nothing. I got absolutely nothing. And it was a process of reduction where it got reduced down to the Aggie joke where two Aggies walk into a bar, the third one ducked. That's it. That's all I got. I would like to share a couple of observations regarding the school experience, starting in kindergarten. Our youngest son did not want to go to school on the first day of school, and he had never expressed much of an interest in school, and really didn't all the way through. It was more of a distraction than anything else. But our son Michael absolutely refused to go to school on the first day of school. And we're both educators, so we know the drill. We know how to talk about, oh, it's going to be great. You're going to be with friends. It's really going to be good. Just get there and see. No, not having any of it. And so this conversation was reduced down to my declaration that, Michael, get up, get out of bed. You're going to school. It's the state law, period. So later in the day, we get a call from the school, and the kindergarten teacher where Michael went is a dear friend of ours, lifetime friend, Karen. And she said, I had to, during my conference, I had to call you and tell you this story. So Karen is a revered kindergarten teacher. And she has this ceremony, this very, very, really powerful ceremony of getting the children on the rug the first day of school in a circle. And the question is, why do we go to school? And they go around and she's talking about these great things and, you know, that you're going to make friends and you're going to learn. And there's Michael, clenched teeth, when asked, state law. And this is kindergarten. I since came to really appreciate the first week of school for kindergartners. And In high school, I took a course. It was on death and dying, and we learned about the 5 stages of death and dying, right? Well, I have the 5 stages of the first week of kindergarten, and kindergartners are amazing little robust human beings. They are warriors, and on that first day of school, they are super excited. So Monday is everything's new, shiny, fantastic. On Tuesday, they realize, wow, I'm here again. Okay, I can do this, and they get their first kind of taste of grit and that determination. They're very happy, they're still motivated, they're still into it, they're still discovering. On Wednesday, day 3, they're absolutely exhausted. They cannot believe that this experience is on to its 3rd day in a row, because that's just not how they roll. And on day 3, they're tired, they're a little worn out of the whole thing. And then day 4 hits. And this day 4 is where you get the stage. They now turn resentful and angry. And now they're belligerent. And that's their first taste of really that deep-seated, now who is the boss of this place? And then they get to Friday and they discover for the very first time in their lives the meaning of thank God it's Friday. And this is the typical arc of the first week of kindergarten, and thus it begins, the journey in education. I will tell you this, that this journey lasted 30 plus years for Ellen and I, and it seemed like it lasted just like that. It just has been a wonderful, wonderful experience, and I could not be more proud of being associated with Texas Public Schools. There is nothing better than Texas Public Schools for our kids, for your kid, for my kids. We have it going on here, and it is worth fighting for. And I know most of you, if not all of you, understand that. So let me get started on my comments tonight, and I'm going to keep this uplifting with a little humor, some more school stories. But I do have a passion about this topic. And for me, it was going to work in Hayes CISD as superintendent in 2010, reading, going down my driveway, getting the Austin American-Statesman, and seeing this headline above the fold on page 1. And I could not believe it, to be honest with you. It was stunning in its impact on me as a school administrator, because I kept looking at this statistic and saying, what do you mean that 1 in 4 Texans are going to be diagnosed with diabetes in 2040? When I went to school, I had no friends who were pre-diabetic. I had no friends that I didn't know anything about diabetes all the way through college. It really wasn't a part of the general population and the issues of health that we have to deal with. I looked at the statistic and I really could not believe it. And I said to myself, using a coaching analogy all the way back to Gilmer, JV girls basketball coach, never been more proud of a group of young ladies, that how could this be? Because I know as a basketball coach that if I'm putting 2 out of 5 of my starters, 40% of my starters have sprained knees or sprained ankles, we are not going to win very many games. And here I am, a superintendent going off to a fast growth school district where the stakes are high, college readiness, military readiness. We've got to do better with these kids. We've got to improve their writing skills and their math skills. And the kids are not healthy. How are we going to move the bar if our children are not physically healthy? And this really kind of, this headline coalesced my belief that, wait, I need to stop worrying about math interventions. I need to stop worrying about what's the latest, greatest writing intervention in the classrooms, and I need to focus on getting our kids healthy. And it's been a very rewarding journey since then, because it's very validating to this day, as we learned from Dr. Roberts, the statistics about Angelina County, and you're no different than most counties and most states in this country. It's not good. In fact, from this study, Angelina County, 2010, 12%, you're projected in 2040 to be 24%. That's doubling. That's doubling the number of the population that has diabetes. So we need to get after this, and it's not just diabetes, obviously. So there is both the collective cost to all of us But there is also the individual cost to the future of a child, your child, my child, our children. And from a moral and ethical responsibility, we must do better. We must do better, right? But from a collective responsibility, it starts to get really kind of dangerous where we are and where we're going regarding the collective cost on healthcare, the collective cost on our economy, and the collective cost on our military. And I want to show you this slide. There is a group out there called Mission Readiness. It's 750 retired admirals and generals. And they have raised the alarms. They've sounded the alarms that, folks, we've got a problem. And the problem is that 71% of our military-aged eligible citizens, 71% do not qualify for the military. That is a national security crisis. 7 out of 10 17 to 24-year-old men and women do not qualify for military service for 3 reasons: drug and alcohol convictions or abuse, lack of education, and obesity. And they go state by state. Here in Texas, 73% of our 17 through 24-year-old population does not qualify for the military. Now, think about that for a minute in terms of the 27% left over. Those 27% that do qualify, they're being courted by your top companies, they're being courted by your best universities, and the military option is probably somewhere in the mix of many, many other opportunities that they have. So we really have to do something about this. It's not an option. These kinds of statistics are alarming, and I will say this: schools cannot do it alone. They absolutely cannot do it alone. I have one more slide. It's a little complicated. We'll go very quickly on this one, but this is the intergenerational cycle that is developed when you have inactive parents, when you grow up in a family that really isn't paying any attention to the diet and exercise and physical activity. It starts to cascade and it becomes this intergenerational problem that is very, very difficult to break. And this is the challenge that we have. It's always been the challenge to break generational cycles of whatever it is: tobacco use, obesity, improving your exercise habits, these kinds of things. So I want to spend a little bit of time looking at the causes. The causes are food is an issue. And I'm not going to go long on this. I know we've all heard the sermon on this, but that upper left photo, moms and dads, when they bring their kids to grocery stores or supermarkets, they do their thing and then they're faced with what I call the gauntlet. And the gauntlet is the checkout aisle that has this sequential offerings of amazingly delicious treats. And by the time you run the gauntlet, either the kids have gotten what they want or everybody's screaming at one another. And it's not just the grocery stores, it's book people in Austin. I'm standing in line and I'm looking at this 30-foot row of chocolate because at some point in life, I guess you can't read without chocolate. But this is the world that we live in. And it's really everywhere. And I want to take a diversion along the sugar path for a minute. But on the lower right is the picture of a cupcake. And I'm the superintendent in Frisco that banned cupcakes at elementary schools. And that was not explicitly a popular move, but it also was this quiet thank you from a lot of parents because they had to cook the cupcakes and they were sick of it. But unrelated and unbeknownst to me, about 2 weeks after I eliminated elementary cupcakes at Frisco, from the school day, I love a cupcake, they're great. We're just not going to feed them every day to our children over and over and over again. Our agricultural commissioner, Sid Miller, he puts a podium up outside on the sidewalk and declares cupcake amnesty for the state of Texas 2 weeks after I banned cupcakes. Unrelated again, but Sid did not help my cause here. And I got a little flack from that. All right. I do want to say that working for the Cooper Institute for this past year was so incredibly impactful to me, working with Dr. Cooper, this world-famous icon of preventative medicine. along the way, I learned so much, and we are in a place where we have to look at sugar and the sugar content in food, and I kind of got deep with that, and I want to show you something. Okay, in this glass, which is about 40% full of granulated sugar, this is 141 grams of sugar. This is the amount of sugar, and believe me, I'm not picking on this ice cream place any more than it could be any of these places. But this is the amount of sugar in a large s'mores blizzard, 141 grams of sugar. Okay, and that's not okay, right? That's not okay as anything other than, I don't know, splitting it with 5 family members. But that's a lot of sugar, right? And so part of this whole issue is how could this be? How could we get this? And I think I stumbled as an educator a little bit on the answer, because I've got another one, same 141 grams of sugar, but I know one magic trick. I can make this sugar go away, and you can too. Because we take a bottle of water, and we pour it into the glass, and we're going to stir it up, and my wife, the physics teacher, says, use warm water. So how are we going to keep it warm? So it's not exactly warm water, but we're going to get there. So we're going to stir it, let it sit for a while. There was a study of 400 most popular restaurants in America, and 92% of the kids' items on those menus of 400 most popular did not meet nutritional guidelines. It's even worse for the adult menu. We were joking earlier about you go to an appetizer menu on a restaurant, there's one healthy choice and there's 9, not so healthy. And boy, wouldn't it be a great thing if we could flip that, but we flip it in a way that we all like it, that's what we wanted to order. It's very, very complicated space. The other main culprit, besides food, is screen time. And this is also coupled with a new dynamic. If you are a parent, if you are dealing with children, this is really, really alarming stuff that's happening with our kids. Do you know there's this video game, I've never laid eyes on it, called Fortnite? Do you know that 125 million people play Fortnite? That is greater than the population of Mexico. And they're not just playing it casually. Our kids, your kids, my kids, apparently are playing Fortnite. Kids are online 20 hours a week on average. There are studies that say that kids now are on screen time more than they sleep. I'm going to read to you from a very recent New York Times article on this phenomena. And if this doesn't kind of alarm us, I don't know what would, because these are coming from the sources. These are the people who created these things. They don't let their kids near it. So the title of the New York Times article is "A Dark Consensus About Screens and Kids Begins to Emerge in Silicon Valley." This is the guy who was the former editor of Wired magazine, and he's now a chief executive of robotics. He says, on a scale between candy and crack cocaine, it's closer to crack cocaine, Mr. Anderson said of screens. Technologists building these products and writers observing the tech revolution were naive, he said. We thought we could control it, Mr. Anderson said, and this is beyond our power to control. This is going straight to the pleasure centers of the developing brain. This is beyond our capacity as regular parents to understand. Followed up with this. Tim Cook, CEO of Apple, said earlier this year that he would not let his nephew join social networks. Bill Gates banned cell phones until his children were teenagers, and Melinda Gates, his wife, wrote that she wished they had waited even longer. And then finally this, Steve Jobs, heart and soul of Apple, would not let his young children near iPads. Folks, if that doesn't tell you something about we've got to respond to this issue of screen times, because boy, when I read that, I get a little scared about what we're doing. You know, let's talk about wearables, right? Wearables. You know what they found when you put a wearable on a kid in our effort to improve physical fitness with the kids, physical activity? Because we all love counting steps, right? You know what they found with kids? They found this is the result. They loved it for 2 weeks and then they grew to hate it. And they grow to hate it because it reminds them of what they're not doing, and it becomes this albatross around their wrist, and they end up abandoning it, and they form negative associations regarding physical activity. The exact opposite of what we would ever want to do with a wearable, a Fitbit or a Garmin. And the problem is we're not going to solve this childhood obesity issue through technology. It can augment it, it can do some cool and snazzy things, but it is not going to provide the solution. Let's see how our sugar's doing. We're almost there. So, as this sugar clears up, and it would dissolve if I had used hot water, I ask you this: who in their right mind would serve this to a child? None of us. Here, you're about to go and have a math test, have this nice half glass full of granulated sugar. And yet we say, hey, let's swing by and buy this or buy that or buy this or buy that that's really got the same amount of sugar in it. And this is part of the problem. We need to educate our kids as to where that hidden sugar is in our foods. Let them make good decisions. Let all of us make good decisions. But you know, we've got to start figuring this thing out, because I really, honestly, God to believe, do not think that anyone in this room would ingest this amount of sugar in any one setting just as it is. And yet we do it all the time when it's blended, when it's clear, and it's in a liquid or a product that we just don't see and don't know and don't pay attention to. And we're all in this together, and we've got to solve it. So, sobering, so let's lighten it up a little bit. I would like to share with you how to get started on this. And I want to share with you a moment in my career. Everything I learned in education, I learned as a middle school principal. We were laughing today. You have two choices in middle school if you work in middle schools. You can laugh, or you're done. That's it. And if you have a good sense of humor and you can laugh at the human condition, you can have a great time. So, I'm a middle school principal. I had this great idea about improving the climate on my campus, and that was to get a jukebox in the cafeteria. I got the jukebox. I said to the jukebox company, don't you dare put any risky music onto the jukebox. No drugs, no alcohol, nothing like that. Of course, it ruled out about 92% of the music, but other than that, I said, okay, fine, play oldies, but let's just, let's have some good music. So, true story, during lunch one day, my superintendent comes to visit me, and he shows up with the assistant superintendent, and when you're a principal, you straighten up when the superintendent arrives, and it doesn't matter. They used to have code words, the eagle has landed, when the superintendent was cited. You straightened your act up. And he was there to just do a walk around, which superintendents do. So I said, okay, let's go down to the lunchroom. Let's take a look at the 8th grade lunch. And I am going to play you the song that was emanating from the cafeteria as we were walking down to the lunchroom. We're walking. We're getting closer. I'm listening to this. This is not going to be good. I know what's about to happen. He hears it too, but he's deadpan. He's acting like he doesn't know. We're about 15 feet away from the door. I'm opening the door. I swear to you, 325 eighth graders, little girls, big boys, go, tequila! Just as my superintendent is standing there. I said, welcome to eighth grade lunch. And, I got to thinking about it afterwards, and are we like genetically programmed to know that song? How do all the eighth graders know exactly when to go tequila? So that's a research study that needs to be done. We need to find the, when in the adolescent development do you become hardwired with tequila, the song. So the solution is to start waking up, all of us, right? In my case, yes, the tequila moment was not good, and that jukebox was gone that afternoon after he left. But to wake up is to take notice of the conditions around us in all forms and fashion, everything from the fast food environment that we live in to choices in grocery stores and in the school environment to what's going on. I used to make a habit of just doing the random drop in on the cafeteria, not to inspect, but I was curious as to what the quality of the food was in our cafeterias. And I encountered at the elementary school the fruit of the day, thus checking the box with USDA regarding food requirements. The fruit of the day was pears, and there was this beautiful tray of pears laid out there. Well, the pears were rock hard, right? They're these green, just really hard pears. And the observation from my end was, well, heck, these kids don't have any teeth. They just don't. How are they going to gnaw on this pear? And so one of their first formative experiences with this fruit, pears, not exactly positive. Now, there's so many easy solutions to that. Prepare the pear in a different way. Ripen the pear in the back. Slice it up. Well, we can't do that. We can't do that. Yes, you can, because guess what? Our kids' health and wellness is at stake here. I think this is pretty important. So we did a lot of things like that, and we started really changing the paradigm within our school system of how we looked at health and wellness and the physical built environment. And there are so many things that we can do. This is one of many of the famous quotes by Dr. Cooper, and this is true, right? Way easier to build a healthy kid if we're all in this together. And the way you build a culture of health these days is that every single one of us in this room has some degree, some interactivity with having a voice and being able to say, hey, let's choose this healthy alternative, or let's go take a walk. And I know I'm speaking to the medical community, but the power of the 30-minute walk, actually, as a superintendent, if I wanted to identify what's the silver bullet that is the greatest impact of all on staff and kids, it would be that we would all walk, and we would walk a lot. And study after study after study shows this is another learning. You don't have to run marathons. Take a 5-minute walk, turn it into a 10-minute walk, turn it into a 15-minute walk, and start walking 30 minutes a day. It's unbelievable. Unbelievable, the benefits on your health. We are getting smarter, but we have to be advocates for this. We have to push our school boards. We have to push our school administrators into understanding that the silos don't exist anymore. You're not going to have your top flight math scores if your kids aren't healthy. Let's get them healthy. Let's build in some of those things together. There is a pivot point on all of this where you go from trying anything to being more strategic and building policy and building rules and regulations around it. And whether it's your local school district or whether it is in your corporate environment, which is ripe for all of this as well, you can make a difference by getting involved. One of those pieces is also finding the champions, because they're everywhere. And if you just allow that voice to rise within your organization and encourage the person who has an interest in this space, you get remarkable results. The things that we know about kids, one of the quiet things that you can do with your school district is, for instance, if elementary starts late and high schoolers start early, the research says you should flip that. The research says that teenagers need more sleep. They need the later start time. Why don't they get the later start time? As a matter of course, it's usually driven by the athletics and the after-school athletics. So these are things where there's a lot of people who want to do good in schools, but they really don't understand how schools work, and that's part of it, is to kind of collectively work with our local school district to improve conditions and create a culture of health. We are still really beginning to understand the dynamics. This is a famous slide now from the Naperville School District in Illinois. It's a composite of 20 kids. 20 kids' brain scans after resting, 20 kids' brain scans after mild activity. And the theory here is that the group on the right that is exercised, their brain is firing on all cylinders. They actually might perform better on standardized tests. They might perform better in the classroom. Every bit of that observation is turning out to be true. There is an avalanche upon us of research, really, really good research, that is demonstrating these amazingly consistent and remarkable relationships. If you want your children to have better attendance and higher grades, work on their fitness, work on their health, their diet and exercise, because the correlations are coming at us in waves now. And these are big studies. These are, the attendance study, the biggest one is New York City Public Schools. 325,000 students showed a direct correlation between fitness levels and attendance in schools, which doesn't surprise us. That makes sense, right? And these are the things that are happening in this space of trying to understand how to get kids healthy. This is the whole child model, and this is a beautiful model in some regards and kind of clunky in others. But all you need to know on this slide, look at the community. The community has to envelope the activities inside the school that have to envelope the health and care and wellness of the child. And we know this is what we all want, but there are resources on the whole child model that really are pretty simple. It's connecting the brain and the body. It's talking about the social, emotional, and physical aspects of development additionally to the academic concerns. And in this day and age, honest to God, folks, could you or I take it as kids when we look back on our middle school and high school experience? Could we take it if we had this world of cell phones and selfies and anything that we did goofy maybe is snapped on a picture forever, sent out to the world? I feel sad for kids these days that are trapped in this technology world that hurts them emotionally. And boy, let me tell you, most districts, in fact, it was a legislative action item to increase money for counselors, desperately needed in Texas. We've got to help these kids with the stress that we're putting them under and their social emotional needs in our schools. That's a very important aspect of this. So it's very popular these days to challenge people to their why. We hear that a lot. What's your why? There's my why as an educator. I don't know this young man, but I do know this young man. And I know that I've had the honor and pleasure of working with, frankly, after 31 plus years, hundreds and thousands of young men just like him. I feel like we owe him what we got. We owe him the same opportunities and the same experiences in life that take him to be whatever he wants to be, but to be a productive part of our society. And I look at all of the things that are going on in schools, and you look at how we're doing things. It's not complicated. There's your why. There is your why. We have wonderful children, and we're very proud of them, and we need to take care of them. It's pretty simple. Schools cannot do it alone. We are in it collectively. If there's one thing that I try to do, it's connect school environments with opportunities out there in communities. You've got a great platform here in Lufkin. Angelina County is really ripe for the kind of strategic planning that moves the needle and helps improve health outcomes for kids. And it does take all of us. So I applaud you. I'm sitting in a room full of health champions. You guys are rocking it, and I appreciate it. And we really want to make a difference here. So thank you very much. Anybody want a glass of water?
Let's give Dr. Lyon one more round of applause. Thank you. We are thrilled to have so many in our medical community here tonight, physicians that are here. If you did not sign in at the front desk, sign in and fill out the CME form, and you will get CME credit for attending tonight. But you got to fill out the form and sign in. Tara Watkins is going to make her way up to the stage, Chamber President and CEO, for our award presentations tonight. As we celebrate those who have made significant contributions to healthcare in East Texas, I want to take a moment and honor those who have been recognized over the previous 10 years with our distinguished awards. Many of them are here with us tonight. Their names are listed on your program. If you are a previous recipient of a Salute to Healthcare award, would you please stand and let us recognize you? Thank you. Our first award to be presented this evening is Nurse of the Year. Our Nurse of the Year understands the big picture when it comes to nursing, and that to be a great nurse means more than just administering medications or charting. Nursing in the 21st century combines solid critical thinking skills related to both diagnosis and treatment, administrative skills dealing with regulatory bodies, payers, and the federal government, as well as compassionate care with patients and families. That describes our Nurse of the Year well. This nurse also demonstrates a commitment to continual learning, having gone on from her RN and earned a bachelor's degree and now working on a nurse practitioner degree. She is a leader in her field, which happens to be hospice care. And she is one of only 2 nurses that is currently certified in hospice and palliative nursing in the entire Deep East Texas region. She has been promoted to the highest nursing position where she works, the role of Director of Clinical Services, and by all accounts is the best person anyone could imagine for that position. Not only has she demonstrated leadership in her work, she has been active in the community as well, active in the Junior League of Lufkin, and supporting other organizations such as the Alzheimer's Memory Walk, Reading for Kids, and the Joe W. Elliott House Benefit Auto Show, not to mention assisting with feeding local nursing home patients during Hurricane Harvey. She mentors others by working as a facilitator in the Beautiful Me Mentor Program and has been a role model for disadvantaged youth. Her hospice leadership earned her a spot on the board of directors for the Texas and New Mexico Hospice Organization as well. Her can-do, no-nonsense approach means she gets things done, but her compassion always shines through. Let's watch the video about our Nurse of the Year.
I know Amber through the Junior League of Lufkin. Currently this year we work on a community project called the Girls Rock Academy. It's a mentoring program, and I'm the chair and she's the co-chair. I think Amber's a terrific person. I think that during the time that I have known her, I have got to know a side of a healthcare professional that a lot of people don't get to see. And even when she's not helping in the medical aspect, she's still thinking about how she can be helping people, either tomorrow or what she can do to improve on tomorrow. So I think Amber's an amazing person.
Well, she likes challenges, and she challenges us mostly. She challenges her nurses to be the very best that they can be and make sure that every patient receives the best quality of care. But, you know, in hospice, we have patients that have challenges with pain, challenges controlling symptoms, and sometimes just the challenge of their living arrangements and environment. She tackles every one of those, sits down and looks at it from a critical standpoint and analytically determines what is going to be the very best for them. And I think that's what our medical directors love about her is she doesn't bring them a problem, she brings them a solution.
She was a godsend, and she probably is to every person in her care. I know she's a godsend. That probably at the time she was closer to Elizabeth's age than other people in her life. And so there was a connection there. It was someone youthful, someone that Lizzie, like I said, Lizzie could tell Amber things that concerned her that I think she wasn't comfortable in telling me. And so, like I said, Amber was that bridge. I mean, she helped us keep that connection together in my family. And I don't know how we would have made it without Amber. I honestly don't know how we would have survived without her helping us and in our lives.
Amber has served in various capacities. When she came to work for us, she was a clinical field nurse. Now she is the clinical director for our organization. And this year alone, she had to do something that would be very challenging to most nurses, and that is care for the husband of one of our nurses who has been with us for a very, very long time. And I asked the staff member, what did she really admire most about Amber's care in what she provided for her husband? And she said, trust. We could trust that Amber would come, and she was insightful. She knew things about him before she had to ask. She comes in and does those type of assessments. And so her insightfulness, her ability to be trusted and to achieve that with the patients that she serves. She's compassionate, but she's always seeking to make them better and ensure that their end-of-life experience is one that eliminates pain and gives them great gain.
I think what drives Amber to be a servant, I think it is a calling. I think it is what God has said, this is what you're going to do, and she has embraced it, and just that love of people and that deep down desire to be a help to other people.
Tenacity, spunk. She's a very strong woman. She wants everyone to be at a 10, and she doesn't settle for less for herself.
I think joy, bringing joy to other people, helping other people, and that kind of plays into her role in the community. I mean, the job that she has is helping people in their most difficult times, and I think she seeks joy and peace just from knowing that she's made them feel at peace.
Amber, we love you. We thank you for your commitment to Hospice in the Pines. We never want to see you go. We want you to always be in a role with our organization because we believe that the success that we have is attributable to the leadership that we have, and she is a very strong part of that, integral part of the success of Hospice in the Pines.
Ladies and gentlemen, please help me congratulate our 2018 Nurse of the Year, Amber Warner. Okay, you could have gone back.
Okay, well, they told me I have to speak, so here it goes. I'm extremely overwhelmed by emotion. I figured it out when I got here, which was extremely overwhelming. I think I've sat in silence the entire night, hoping I didn't have to make a speech. So I am so blessed to be surrounded by a circle that supports me and encourages me, from my work family to my friends. And you know, people always say when you love what you do, you never work a day in your life, but I kind of disagree with that, because I think when you love what you do, you work harder every day to be better and to make a greater impact. So that's what I try to do. So I am so honored for this. So thank you guys, and God bless.
Our Individual of Merit category is designed for those who may not necessarily be part of the healthcare community, but whose contributions to healthcare in our community are especially noteworthy. This could be a board member, philanthropist, journalist, government official, company or foundation executive, community leader, as examples. Our Individual of Merit this year has worn many hats in her lifetime, from soccer mom, baseball mom, football mom, and cheer mom to PTA president. And I'll just be honest, it's impossible to even start to talk about her without revealing who she is, because she's no stranger to the healthcare community, not only in her own work, but also being related to a family practitioner, a urologist, and a veterinarian. On April 3rd, 1996, her world was forever changed when their oldest son died by suicide. Since then, mental health has been her passion. She chose to go back to college to complete her master's in counseling and worked in private practice as a licensed professional counselor for many years. She eventually closed her practice and became really a full-time advocate for mental health and suicide prevention. Any of you who have seen her Facebook page, Walking for Scott, in honor of her son, where she routinely posts inspirational messages and advocates for awareness, will know what I'm talking about. Her intentional continuing to carry the burden and stigma of suicide in order to educate us and help prevent suicides is both remarkable and awe-inspiring. So let's watch a video about our Individual of Merit.
I first met Pat as a young mother. We were both very busy raising children, and our lives were very full. Jansen was the replacement for my doctor when my doctor was out, and I raised 3 sons, so you can only imagine how many trips to the doctor and the hospital we made over those years. But I would say that our lives were full. And then the unthinkable happened. A parent's worst nightmare, a child's death. And for Pat and Jansen, it was Scott's suicide. I think at that point, Pat has used the words to describe her feelings as, I either was going to shut down or I was going to put meaning to my pain. And in choosing to put meaning to her pain, she did a phenomenal job.
Let me just say, Pat is one of the most courageous women I've ever known. She turned the darkest time of her life into a call to action for mental health awareness. Prior to the passing of her son Scott on April 3rd of 1996, there were no resources in place to help those who've been impacted by suicide. And Pat led the charge to change all that. She made the decision to go back to college to obtain her master's in counseling from Stephen F. Austin, and she became a full-time licensed professional counselor. And then at some point, she decided she needed to be a full-time mental health advocate. And so she decided to take that on full-time, and that's what she's doing.
And one of the first things that we realized after Scott's suicide is that our school needed some direction in how to deal with these kind of problems and how to deal with crisis and trauma and death. And So we gathered together a group from Lufkin, and Pat was part of that crisis planning group to bring in a consultant to write a crisis manual for Lufkin schools. And within 6 months, we had a manual for intervention, prevention, and postvention for the Lufkin schools, and it also had provided 3 training sessions for counselors from county-wide schools.
In the past, the word suicide was kind of a taboo topic, and Pat has made it more okay to talk about, more open. And just a few months ago, she was responsible for bringing a documentary called "Suicide: The Ripple Effect" to our local theater. And I know at the time she was very concerned that anyone would attend. Well, it was a total sellout. And so it was so comforting to see that many people there to support the cause, but also that many people who are seeking knowledge about the topic and are talking about it.
It was said centuries ago by Aristotle that to educate the mind without educating the heart is no education at all. And that's what you've done. You've educated our hearts through your caring, your compassion, and your love. Probably the 10 best years of my practice was spent with you and Deidre in our little office on West Frank Street. And that's what I saw you do. I saw you educating people's heart.
The impact that this has had on their family is tremendous. Pat and her 2 daughters, Angie and Emily, the past 3 years have participated in a walk called Suicide, called Out of the Darkness. And they carry luminaries in honor of over 300 people this past year. I think that the first year they started with maybe 75, and each year it's grown. The neat thing is they don't know many of these people, but people reach out to them, and so they decorate these bags. 300 of them they take, and they decorate and they place in honor of people who they've never met. But her reach is so far, as I said earlier, not just in Lufkin in our community, but all over the world.
After her years in counseling, she decided to become a full-time advocate for mental health. Too often, mental health is not spoken about, and mental health is health. And she felt like people needed to hear about it and know about it and be able to identify when people are struggling and need help. And so she created a forum on Facebook called Walking for Scott, named after her son. And on this forum, she shares her feelings and her struggles that she's gone through with her family. She's very open and honest with her feelings. And because of that, other people share their stories as well. So this platform has grown and grown, and there's so many people who have been connected to her who do not know her personally.
I guess the thing about Pat, though, that people don't see is behind the scenes Pat. I think other people have alluded to it, but, we know about her Facebook page, we know about the things she's doing publicly, but what you don't know is she is that resource for so many people. And I'm not talking just in our community, I'm talking all over the world. She has contacts, whether it is a text or a phone call. She's leading support groups at schools. She's talking to patients in the hospital and their families. She's talking to hospice patients. Anything and everything to do with mental health, she is that person. And she is the most genuine person, but she's the most empathetic person I think I've ever known.
It has been said that people will forget what you said, and people will forget what you did. But people will never forget how you, Patricia Todd, made them feel. So much light and love to my forever friend, Pat.
So Pat Todd, thank you for putting meaning behind your pain. And restoring lives.
Ladies and gentlemen, let's congratulate our individual of merit, Patricia Todd.
what to say, but I will never forget how I felt tonight. Thank you.
Looking at the first 10 recipients of the Healthcare Professional of the Year award, most have been physicians, but not all. Our Healthcare Professional of the Year this year is a graduate of SFA and has worked within both hospital systems. Notably, this person is known for a deep and focused commitment toward healthcare access, specifically for the low-income, uninsured, and underinsured. Collaboration is this person's middle name, whether with local schools, foundations, hospitals, or with state or federal agencies, local healthcare providers, service organizations, pharmacies, whatever it takes to get care for those in need. This person has saved taxpayers and patients literally millions of dollars through a donated pharmaceuticals program. Disaster preparedness is another area of expertise for this person, whether dealing with an H1N1 flu epidemic, preparing for a bird flu pandemic, watching out for Ebola, or simply getting ready for hurricanes. It is all in a day's work. Infectious diseases are always at the top of this person's agenda, from meningitis and tuberculosis to HIV and HPV. Working with our schools to make sure our kids get vaccinated and our schools are safe is so important. Thanks to this person, Angelina County has a strong STD program, school-based health care, disaster preparedness plans, environmental health programs, and more, in addition to basic primary care for thousands who would not otherwise have care. For nearly 20 years, this person has been the face of the organization that is integral and indispensable in the care of our most needy citizens. So let's watch a video about our Healthcare Professional of the Year.
Does she do things well? I believe she does, because I believe she has a passion and a dedication to community health practices. When you help others and teach them, when you believe in early intervention and you can make a difference in the lives of people and their health practices, she believes that she can do that, and she works very hard to see that that agency follows through.
Yeah, she took the Angelina City County Health District as her mantra to do something, and she has carried that forward since day one. And as I said, she's never quite satisfied. She's always very complimentary of what's been accomplished, but that's not quite good enough, because tomorrow we need to do something else, you know. And I think that's why we in Angelina County and the city of Lufkin have the quality of health district that we have today. She never failed to listen to the input of the board of directors, and I think as a result, her board of directors listened to her.
She's committed to her mission. She cares about the patients and the individuals who come to that clinic for programs and services and for help. She is totally dedicated to the task of improving the human condition and helping those who are in need. And she inspires that same commitment in her staff and in her, the entire health clinic team.
She's the linchpin that has held the Angelina City County Health District to the high standards that it holds today.
She never looked at a challenge and fret over why we can't do it. Sharon always, her approach was how we can. Not why we can't, but how we can.
At this time, I'm on a coalition, and when she brings statistics to us, those are more than numbers. Those are people. They represent the lives of people, and so she's always looking for a way to improve health of individuals. And I truly believe that she makes a difference in this area because community health is her love and her passion for the people that she serves.
Please help me congratulate our Healthcare Professional of the Year, Sharon Shaw. And Sharon, I believe you have some other people that are coming in as well, so come on up.
Thank you for the wonderful reason for my children to be here. I want the staff from the health district to stand, please. That's the real team right there. Dr. John Wood, Dr. Rudis, Dr. Huber, those that are on our team, those physicians that we refer to that help care for those patients every day. All of you that work so hard to help us achieve public health in Angelina County. We've been called to task tonight. Children's health is our future, and we need to work together to improve the health and lives of our children in Angelina County so we can move forward. And 5 years from now, when we have our banquet, and 10 years from now, that we've improved the lives of our children, and they're standing here and they're sitting here, and they can appreciate what we've all done. Thank you.
Go see those kids. So now it's time for the Lifetime Achievement Award. This award is given to someone who has had an extraordinary impact in the Lufkin Angelina County healthcare community over a lifetime. And I'm sure you will all agree our recipient fits that bill. In past years, this award has gone to physicians, nurses, and an administrator. Both women and men have been honored. Our honoree first arrived in Lufkin for a meet and greet of the Angelina County Medical Society members in 1976. He would later serve as president of the Angelina County Medical Society. And since his bicentennial arrival in Lufkin, he cared for generations of citizens until he retired 35 years later in 2011. One longtime fellow internist described him this way: he was the consummate physician, a physician's physician, very caring, very thorough. His compassion and commitment extended beyond his practice in Lufkin. Not only was he involved in county, state, and national medical organizations, he served on the State American Heart Association board as a camp physician for Young Life, and volunteered on medical mission trips to the Amazon River Basin with Amazon Outreach. Beyond medicine, he's an excellent photographer, and an avid gardener routinely sharing his beloved roses with others. I'm sure by now many of you know of whom we speak, but let's hear what others have to say about our Lifetime Achievement Award recipient.
I remember one of the first times I ever met Dr. Willis. He came to the unit and he always had a sport coat on or a suit. He had a bag with him, the typical doctor bag. And I was always impressed by that because he was the only physician I ever saw who carried one. And I'm sure most of them had them, but Dr. Willis brought his with him every time he made rounds. And he had all of his stethoscope and everything else in there that he might need. May have been because at that time, years ago, we didn't have it for him and he had to bring his own. But he was just the ultimate professional physician walking down the hall.
Dr. Willis has been here for many years, and during the time I've had a chance to work with him, he's quiet, he's to himself, but he sets a model for the practice of just general practice with people. He was always kind to his patients, very informing to his patients. He took care of them, hovered over them, nursed them. He had an older practice than I had, and he kind of helped me see what it was like to get established and how to do this correctly.
Dr. Willis was an amazing physician. He was very personable with his patients. He knew them. He knew their families. They were very comfortable with him. So when Dr. Willis would make rounds every day, he was also very predictable in that when he finished his office, he would come make rounds at the hospital. So I worked 3 to 11, and I knew Dr. Willis would be rounding, so I didn't take my lunch break until I knew Dr. Willis had come and gone, because he was an awesome teacher. So when you made rounds with him, you not only learned about his patients, but you learned about their disease process. And as a brand new nurse, that was awesome for me. I could learn and ask questions, and it was no longer a classroom setting. There was no longer a stupid question. And he was so gracious and eager to teach because he knew the more we knew about the disease process, the better care his patients were going to get.
As I've not had a chance to work with him in the last several years since he's retired, I miss his dry humor. He would come in and say things that you would kind of, is he being truthful about that or not? I mean, he's had some episodes where he mentioned, we asked him about retirement years ago, and he said, well, I'm going to tattoo on my chest. I've got a gypsy blue and tattoo that it says, give drugs once, shock once, and then quit. We were discussing one day about our frustrating patients. He said, every January 1st, you reflect on your worst patients of the year, you write the first 10 down, and the next day you go in and just fire them because you're not doing them or you any good. He may not remember those things, but they stuck in my mind, and the way that he said them was like, this is just a matter of fact, this is what I'm going to do. And in retrospect, they were humorous, but they were quite humorous.
But one of the funniest things about Dr. Willis is the story he tells about his young son at that time answering the phone one night when he was in the shower, and a hospital, and I don't know which one, called about a patient, and his son told them his father was tied up, but go ahead and get an EKG and call him back when that was done.
I think the strangest thing that stands out to me is that when my son was about 11 or 12, Tom called me out of the blue, and we hadn't had dinner together a lot or coffee. He was a friend. I'd seen him at the church. He was still in the medical industry, busy guy, and he called and asked me if I thought my son would like to go fishing with him. And that's periodically people ask that, but not very often. And it just still to this day, it strikes me that here's a guy who's working 60 hours a week in the medical industry, and he's in a local doctor in a smaller town. People call him night and day. He can't walk in the community. And he actually took time out to ask if he could take my 11-year-old son in his rowboat to fish. It just really shocked me. And he did this on 3 or 4 other occasions. That's who Tom really is. I mean, all of the stuff that people know him for is him as well. But the quiet guy who's willing to come alongside you and serve you, I work with lots of people. I have been working with people for 30 some years. I've never quite met many people who are willing to quietly do what he does.
All right, ladies and gentlemen, let's congratulate our 2018 Lifetime Achievement Award winner, Dr. Tom Willis.
Thank you very much. In the many years I was here, we saw many developments, and I thoroughly embraced those and enjoyed them. And the things I didn't always like were the cultural changes that occurred in medicine, because I can remember a psychiatrist teaching us just as we were about to graduate, and he talked about medicine being a cruel mistress because one was taken over so much by the continued need to learn and the continued emphasis on availability and the difficulties that it often caused in families. And I want to recognize my family because of all of the encouragement and management of life that they have provided for me. My wife, Donna, and my children, David and Cindy. One doesn't practice a lifetime without there being a tremendous support system around you. And I want to say thank you to everyone who helped every day for all those years. In my office, the nurses, the technicians of all sorts, and all of the personnel at the hospitals and nursing homes that helped the patients. And I want to say thank you to my patients who treated me with respect. Every single day. Thank you.
Once again, congratulations to all of this year's Salute to Healthcare Award recipients. What a beautiful evening, and what a way for all of us in healthcare to recommit We've got incredible role models to follow. Thank you again to our speaker, Dr. Jeremy Lyon, for a truly thought-provoking and motivating presentation. Physicians, remember to sign in and fill out your forms. And January 1st is coming up. I don't know who we're going to put on our list to fire, but that's a very interesting idea. On behalf of the Lufkin Angelina County Chamber of Commerce and the Salute to Healthcare Committee, we want to thank you for supporting our medical community tonight and hope you've enjoyed the evening. Please be safe driving home, and we will see you next year. Thank you.